Welcome to Malaria Watch TV. This week we'll hear from two members of the Malaria Policy Center team about United States foreign assistance dollars and how they can help end malaria deaths and change the face of a continent. Mark Green is the managing director of the Malaria Policy Center in Washington, D.C. Before joining the Policy Center, Green was a congressman and the United States ambassador to Tanzania, where he oversaw and implemented the programs paid for by foreign assistance.
Well, I think the rest of the world doesn't want to hear rhetoric. It's not so much what we say, it's what we do. And so when we increase the profile of our work, whether it be fighting global health or creating jobs overseas or supporting democracy overseas, we're sending a very clear message as to what we stand for. That raises our profile, and that's really how we build lasting friendships overseas. I mean, one of the reasons that I'm involved in the malaria movement is because this is a cause that I think is productive in so many ways. The money that we invest in malaria, the programs that we have in malaria are measurable, they're verifiable, it's transparent, and we have a very attainable goal: universal bed net coverage for every family in Africa by 2010, and hopefully an end to malaria deaths by 2015. The money that we invest here is as effective an investment in our money in global health as we have anywhere. So it makes a huge difference there. There's another part to it, though, what we call return on investment. By investing these dollars to fight malaria, we're freeing up the dollars in these local economies that they can then turn around to take on other challenges and to create jobs. In some parts of Africa, 40% of the entire healthcare budget is taken up in malaria costs. So if we can help lift those costs, address those costs, we free up hospital beds, we free up the healthcare budget to take on such challenges as maternal and child health, we free up the healthcare budget so they can turn around and train new healthcare workers. So in so many ways, the money that we spend on malaria, that we invest in malaria, really makes a world of difference on every front: economic, healthcare, and so it really provides a great return on investment.
Wendy Taylor leads the Malaria Policy Center's global advocacy efforts and uses her experience in the governmental and global health sectors to form new relationships dedicated to fighting malaria.
Well, it's hard to even think about maternal and child health without thinking about malaria. Today in Africa, 3,000 kids died of malaria. That's 3,000 kids. These are kids that yesterday were probably playing in their playgrounds, running around, just being normal kids. Yet this morning they woke up not feeling well. They had a fever, chills, and eventually, very quickly, the disease progressed and these kids died. So as a mom who just left my 6-year-old at home with a fever, I can't even imagine the magnitude of this nightmare. If we can reduce the burden of malaria off of childhood mortality in Africa, the impact will be enormous. For example, in Zambia, with expansive malaria control efforts, they've been able to reduce the incidence of malaria by 50%, and they've been able to reduce all-cause child mortality by 30%. That frees up healthcare workers to be able to focus on other diseases, such as diarrheal diseases, or be able to focus on infant mortality.
Well, you know, I understand that times are tough, and of course, as a member of Congress for 8 years myself, I understand that tough choices have to be made during these difficult economic times. But really, the money that we invest in global health in general, and malaria in particular, is money that's wisely spent. It pays off for us in so many different ways. This is money that really provides a return on investment over and over again. So, you know, we all know that tough choices have to be made. But if we continue to build as we have been towards sound investment in malaria programs, I think in the long run it's not only going to save us money, but it's going to build those programs and those friendships that will make a lot of our other expenditures more efficient, more effective.
We have the tools today to tackle this disease. This isn't a scientific problem. We know how to solve this problem. We have the tools today. We have bed nets. We have indoor residual spraying, and we have the medicines. So we can take on this disease. The key is putting the resources to bear to be able to make sure that these tools are in the hands of people that need them.
For more on foreign assistance, visit malariapolicycenter.org. Malaria Watch TV is brought to you by the Malaria Policy Center, a project of Malaria No More. We're working for the first great humanitarian victory of this century, an end to malaria deaths.